Hi there, in this video we are going to discuss about cholesterol and enterohepatic circulation of bile acids and bile salts. So what is cholesterol? Cholesterol is basically a ring structure. It has a core of 4 rings, which I am trying to draw here. It has a core of 4 rings, and here goes and here goes. These rings are named as A, B, C, D, and they form the nucleus of cholesterol, and their numbering is done as they are numbered as 1, 2, 3, 4, 5 and 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17. So they are numbered in this way, and between 5, 6 position there is a double bond. At 3 position there is hydroxyl group, and here is the chain here. Here is a branched carbon chain here. So this is the which is hydrocarbon tail, and this is the structure of cholesterol. And cholesterol is a hydrophobic compound because you don't see polar groups here to make it soluble. So it is a hydrophobic compound. Only group it has here is hydroxyl group. However, this hydroxyl is not sufficient enough to solubilize it, and this hydroxyl is usually esterified to some fatty acid, which is RC double bond oxygen OH, which reacts here by ester linkage and forms ester, cholesterol ester. So cholesterol is hydrophobic compound which cannot be transported without being associated with some amphiphilic compound, which are usually lipoprotein particles, or in bile they are in the form of bile salts and phospholipids. So next we come towards the bile acid and bile salts. So what are bile acid and what are bile salts? This is the structure of cholesterol. So bile acids are produced in the liver from cholesterol. In liver, cholesterol is converted to bile acid, and then bile acids are converted later on into the bile salts, and these bile salts are then released into the bile. So what are these bile salts? These bile salts include bile acids include cholic acid and chain deoxycholic acid. Chain deoxycholic acid. So cholic acid is a triol. It has 3 hydroxyl group, and it is chain deoxycholic acid is a diol. It has 2 hydroxyl groups. So what happens in their formation in liver? This carbon chain is reduced by 3 carbon atom, and this is reduced by 3 carbon atoms. Okay, and here is a hydroxyl carboxyl group is attached, which forms acid, and then this double bond is also reduced, and then there is addition of hydroxyl group here, and then there is addition of hydroxyl group here. I should draw methyl group here also, which I previously missed in the structure of cholesterol. So here are methyl groups. So this is the structure of cholic acid. It has 3 hydroxyl group. One is here, one is here, and one is here. So it is a triol. It is cholic acid. However, if this hydroxyl group is absent, there are 2 hydroxyl groups. Then it is diol, which is chain deoxycholic acid. So liver synthesizes cholic acid and chain deoxycholic acid from cholesterol. Okay. So addition of hydroxyl group at C7 is the rate limiting step in their synthesis, and this step is catalyzed by cholesterol 7 alpha hydroxylase enzyme, which added hydroxyl groups here. So these bile acids synthesized in liver from cholesterol, and these are amphiphilic compound. They have no carboxyl group, they have hydroxyl group, which imparts some polar characteristic to it. So it is a these are amphiphilic compounds. Their amphiphilic nature is further enhanced by reacting them with glycine, which is a amino acid, and taurine, which is also a polar compound here. So glycine is NH2 CH2 COOH, and taurine is NH2 CH2 CH2 SO3 negative. So glycine and taurine react with these bile acids and convert them into the bile salts. So they react at this site. At this site, glycine attaches by an amide linkage. It attaches here by amide linkage NH and CH2 COO negative. So glycine is more polar than previously hydroxyl group, so it decreases its polarity, and when glycine attaches, cholic acid convert into glycocholic acid, and chin deoxycholic acid converts to glycochin deoxycholic acid. So they are more polar, and these two compounds are bile salts. These two compounds are bile salts, and similarly taurine can attach here. Taurine can attach here by similar linkage NH2, CH2 and SO3 negative, which is also a polar compound here and increases polarity. And when taurine attaches here, cholic acid changes into taurocholic acid, and taurine attaches, it changes into taurocholic acid and taurochin deoxycholic acid. So in this way, 4 bile salts are produced from bile acid, glycocholic acid and glycochin deoxycholic acid, taurocholic acid, taurochin deoxycholic acid, which are more polar and they are more amphipathic in nature. So liver converted cholesterol to bile acids, and bile acids were converted in liver into bile salts, and bile salts are amphipathic compounds, and these acids are primary bile acids synthesized in liver. These are primary bile acids synthesized in liver. So what function they perform in the bile? Bile has components which include these bile salts. Bile has these bile salts and phospholipids and cholesterol. So cholesterol is hydrophobic, so these bile salts are amphipathic and phospholipids are amphipathic. They solubilize cholesterol in bile, and this bile is then released into the intestine, where it solubilizes the dietary lipids. It solubilizes dietary lipids and plays its role in digestion of dietary lipids. However, the intestinal bacteria, what they do, they remove glycine and taurine. They remove glycine and taurine from bile salts and convert them into bile acids again. So bile acids converted to bile salt, released in bile, solubilize cholesterol there, reach to intestine, solubilize dietary lipid there. Then intestinal bacteria remove glycine and taurine and convert them into bile acids again. So the primary bile acids are recovered here. Primary bile acids are recovered here. However, they can remove one hydroxyl group as well. They can remove hydroxyl group. Bacteria can remove hydroxyl group as well and can convert them into secondary bile acid. Secondary bile acid include deoxycholic acid and lithocholic acid. So this primary bile acid and secondary bile acid regenerated in intestine are reabsorbed from the intestine, by sodium bile salts bile acid transporter, which is present in the ileum, and then they travel in the blood, then they enter in the blood. So what has happened? Bile salts which went to intestine, their glycine and taurine was removed by intestinal bacteria, then bile acids were regenerated. These bile acids were converted to secondary bile acid. They were reabsorbed from ileum, they moved to the blood, and blood they were transported in combination with albumin and lipoproteins. They reach to the liver again, they are taken by liver, then from liver they again go into bile in the form of bile salt, and the cycle continues. This is enterohepatic circulation. So they came from liver, went to intestine, then reabsorbed from intestine, moved to liver again. So this was enterohepatic circulation. However, their small amount is lost in feces, about 0.5 gram per day is lost in feces, and this amount is regenerated in the liver from cholesterol. So if this amount is increased somehow by dietary fibers or by cholestyramines, what happens if this amount is increased? Then liver has to convert more and more cholesterol to bile salts. So in order to decrease cholesterol, this strategy can be applied, in which this enterohepatic circulation is disturbed by bile acid sequestrants, which include cholestyramine, and they prevent the absorption of bile salts and bile acids. So more and more cholesterol from liver is diverted to this pathway, and it helps to decrease the blood cholesterol level. So another thing we should be knowing about gallstones. What are gallstones? We discussed that in bile acids, in bile, 3 substances were present: bile salts, bile contains bile salts, phospholipids and cholesterol. So these two are MB fatty compound which were solubilizing cholesterol. So if cholesterol content increases or their content decreases, then this cholesterol will not be solubilized, and if this cholesterol is not solubilized, it will form precipitates which will lead to the formation of stones which are called gallstones, and this condition is called cholelithiasis. So what has happened in bile? Bile salts and phospholipids solubilize cholesterol. If amount of cholesterol increases or the amount of bile salt decreases, then cholesterol form precipitates which lead to formation of gallstones or cholelithiasis, and this can be due to uh, increased secretion of cholesterol. It can be due to decreased synthesis of bile salts due to hepatic reasons, or it can be due to disturbance in the enterohepatic circulation. So what is the treatment of cholelithiasis? Treatment of choice is laparoscopic cholecystectomy, in which gallbladder is removed. Laparoscopic cholecystectomy in which gallbladder is removed, or the patient which cannot undergo surgery, they are given oral supplements of chain deoxycholic acid to dissolve the gallstone, but it is a long treatment. So it was all about today's lecture. Thank you.